100 years since the discovery of insulin, which is, of course, used in the medical management of diabetes. But only half of the people who need it actually have access to insulin due to challenging storage requirements, complex treatment protocols, and high prices, among other challenges as well. Now, according to the World Health Organization, an estimated 422 million people are living with diabetes, with the majority from low and middle income countries, and 1.6 million deaths are directly attributed to this silent killer every year. For more on the global insulin crisis, that's what we're calling it, I'm joined now from London by Dr. Helen Bygrave, who is the Chronic Disease Advisor for Doctors Without Borders. Dr. Bygrave, it's great to talk to you this morning on the AIM report. And it's an important discussion given what we know about diabetes and its links to higher death rates when it comes to COVID-19.
Absolutely, and thanks very much for having us on this morning. What we're seeing globally is the fact that so many people with undiagnosed diabetes and uncontrolled diabetes are actually the people who are having some of the worst outcomes with COVID-19. Yeah. And I think the pandemic has really laid bare how much we've neglected some of these NCDs, and in particular diabetes. And we really welcome the WHO launch of their Global Compact last week to really try and push this agenda forward.
So talk to us about the Global Diabetes Compact by the WHO, because according to my understanding, there are no global targets set for insulin to help really drive up global access. Does this answer that challenge?
They announced that they are going to be working on targets. Those targets have yet to be set. But absolutely, we've seen in HIV, for example, the setting of the global 90-90-90 targets really kind of drove implementers, ministries of health, and donors, importantly, to a clear kind of forward goal. And I think that's been really lacking in diabetes, and certainly that's one of the things that Doctors Without Borders we're really calling for, is to set these tangible targets that the healthcare workers in facilities, national programs, and at international level we can all work towards together. To ensure that people actually get to know they have diabetes, get on treatment, and importantly, we have a quality indicator that we know that they're being controlled as well with the appropriate medications, including for those that need it, insulin.
Yeah. Given that we know that half of the people who need insulin, that they can't get access to insulin, in the work that you do with Doctors Without Borders, what are the alternatives, if any, that are available in a context where access to insulin is impossible?
Right, really important question. There's two main types of diabetes. So for type 1 diabetes, which often presents in children and young adults, there is no alternative. Yeah, without insulin, this is an absolute emergency, and we see it as such. Without insulin, those young people with type 1 diabetes will become extremely unwell within days and will likely die within days to weeks. And that's what we actually see in many of our projects, is children and young adults coming to our emergency rooms extremely sick simply because they've not been able to access insulin most likely through the public health sector. And for those patients, there is no alternative. Having insulin is a life-saving intervention. Then you've got the patients with type 2 diabetes, many of which, or the majority of which, will be controlled with oral medication. But there is a substantial proportion who will need insulin to control their disease. In those cases, it's not this immediate emergency in many cases, but they will progress to serious complications with eyesight, kidney problems, often having horrible ulcers if they don't get their diabetes better controlled because they need that additional drug, which is insulin.
You know, we look at this Global Diabetes Compact by the World Health Organization, and we look at it in the shadows of what's happening in terms of access to vaccines for COVID-19 around the world. Are you confident that this compact is not going to be something that only ends up on paper?
Well, we're certainly going to be following WHO and pushing WHO to really make sure this doesn't become a paper exercise. This needs to be put into action, and it needs to be put into action urgently. For us, it's a real outrage that 100 years on, 50% of people who don't need a drug, that there are no patents on, cost $2 a vial to produce, simply don't have access. There's a lot of lack of transparency around the costing and the pricing of insulin.
Yep.
And still, 100 years on, there are only 3 companies that really control that global insulin market. And that's one of the key things we're really pushing for, is how can we help some of these, let's say generic, we call them biosimilar companies, enter that market. And one of the things we really want within this global compact for WHO to support is that pre-qualification process of these biosimilar insulins, and to support some of these companies to enter the market. At the moment, it's the regulatory process they face is complex and costly. And we believe that if we can expand that market, we might be able to kind of push towards driving prices down, and also ensure that there's more options on the shelf for the people living with diabetes who need that drug urgently.
I mean, this issue around vaccine equality when it comes to COVID-19, it's something that you, of course, have dealt with over and over in the work that you do, but that perhaps ordinary citizens are now really latching onto in light of COVID-19. What are the responsibilities from individual countries when it comes to increasing access to insulin?
It's a really important point, and we see countries, ministries of health, really struggling with this issue. There's also a lot of, particularly across many African countries, there's a lack of data in terms of the needs for insulin, the sheer volume. So I think there's a lot of work that countries potentially need to do around understanding the actual numbers. And as countries are working towards UHC, universal health coverage, as countries look to the programs they're starting to implement around health insurance, why isn't insulin being included in some of these programs? Particularly, as I say, for those patients where without it, we know they're going to be extremely unwell and die potentially within days to weeks. And so often insulin, because it's seen as complex, it's seen as costly, is often left out. So I would really urge that this is seen as an essential medicine, and that countries really take it upon themselves, or member states see this as the emergency that it is in terms of access.
Dr. Bygrave, before we let you go, we know that diabetes has nearly doubled over the last 30 years, incidence of diabetes. Low to middle income countries, the worst affected. What are we looking at in terms of the future picture if the situation in terms of access to insulin doesn't change?
Well, it's pretty bleak. I mean, it's predicted in the next 25 years, we're going to be up to around 700 million people living with diabetes, with the biggest increase in the African continent. So I think, we need to work at prevention for type 2 diabetes. But as I say, I think unless we start to address this access challenge, we start to look at how we can improve the competition in the insulin market. As that demand, which I'm afraid I think is inevitably going to increase, we're going to have a lot more people with serious complications, and really people living with diabetes really suffering as we go forward in the next decade.
Dr. Helen Bygrave, it's great to talk to you this morning on the AM Report. She joins us live from London as we talk about access to insulin 100 years after it was first 100 years since we've had access to insulin in the world. She's the Chronic Diseases Advisor for Doctors Without Borders. And as